describing how many people are homeless in the US. In order for us to determine that, we must first come up with a proper definition. So what is homelessness? Sam Kurtz in Chronic Homelessness in America, What Is It, and Who is Experiencing It, defines a homeless person as someone who has been living in a place not meant for human habitation, an emergency shelter, or a safe haven. The average person, when they hear the term homelessness, they usually associate it with the stereotypical man on the street begging for money. But those individuals are actually in the minority of the homeless population. Kurtz explains over 500,000 people on a given night were homeless, with 65% staying in emergency shelters and 35% being unsheltered. This means that every night over 175,000 people are forced to live on the streets. That alone is a significant amount of people that should raise some concern, and it barely represents 1/3 of the homeless population. So who exactly are homeless? What type of people consist of the 500,000 that cannot find a home every night? Kurtz refers to the 2018 Homeless Assessment Report to Congress that states 180,413 people are homeless in families with children, and over 110,000 children are homeless. Kurtz also states that over 60% of the homeless population are male. So with over 500,000 people experiencing homelessness in America, adult males are the most common, despite children consisting of more than 1/5. Kurtz finally adds on that in 2018, 33 states had an increase on people experiencing homelessness since 2017. This proves that homelessness in America continues to be a growing problem.
Hi, my name is Dany Ren, and we're going to talk about the homeless people in Florida. In 2018, there was 31,030 homeless people who were reported to be living out in the streets by the U.S. Department of Housing and Urban Development, also known as HUD. So to break it down, there's two types of homeless people. There's chronic homeless people and there's regular homeless people. Regular homeless people are people who are homeless, but they have been homeless for more than a year. And the chronic homeless people are people who've been homeless for over a year, which is usually because of their mental illness or their dependence on drugs. Out of the 31,000 people who are homeless in Florida, 2,757 of those were family households, so that usually means two or more people who live together. 2,543 of them were veterans, so people who served in the military and just haven't gotten their life together. And 1,892 were unaccompanied young adults, ages 18 through 24. And then 5,302 were individuals who experienced chronic homelessness. Once again, those are people who have been homeless for over a year due to their mental conditions or drug abuse. And Florida is the sixth largest state that has the most homeless people in it.
In continuing to talk about the homeless and the Affordable Care Act, there are a few coverage options that are available for these individuals. In the US, there are about 1.2 million individuals who experience homelessness each year, and there has been an expansion to Medicaid to try to provide healthcare access for these individuals. There are also people who are young and at risk for being homeless, and there's also eligible coverage for those types of people as well. One of the coverage options is the Children's Health Insurance Program, otherwise known as CHIP. And then there's also Medicaid and subsidized coverage through the healthcare marketplace. However, there are a few barriers that do exist for homeless people to get access to these services. A few of those barriers include having less knowledge of the Affordable Care Act than their housed counterparts, poor understanding of the Affordable Care Act itself and the qualification criteria for gaining access. There's also limited access to phone and internet for these types of people, obviously for reasons that they're homeless. And there's also a lack of education. Usually there's a history of mental illness for a lot of homeless people, and they are just not very aware of what options are available for them, or have little interest in gaining access to healthcare coverage in general.
The majority of the homeless population in the United States actually has some form of severe mental illness. According to an assessment that was taking place in 2015 by the United States Department of Housing and Urban Development, 140,000 homeless people were actually severely mentally ill, while 250,000 homeless had some form of mental illness. Compare that to only the 4.2% of U.S. adults that have been diagnosed with severe mental illness. The most common types of mental illness among the homeless include depression disorder, bipolar disorder, schizophrenia, anxiety disorder, and the big one, substance abuse disorder. So just how will expanded coverage actually help the homeless? Expanded coverage will allow the homeless to be properly diagnosed and even treated if they do in fact suffer from a mental illness. Many individuals become homeless when the burden of healthcare-related costs take over their lives. Majority can be linked to a mental illness. Expanded coverage may allow the homeless with mental illness to get into programs that can provide long-term stable housing. These interventions help mental health outcomes, including reducing the number of visits to inpatient psychiatric hospitals. A 2015 study concluded that services that deliver cognitive and social skill training, particularly in developing and maintaining relationships, would be useful in helping people with mental illness and homelessness regain housing. There is actually a small change when it comes to the new administration and the expanded Medicaid options that the previous administration had. Before the ACA, most adults facing homelessness did not qualify for Medicaid unless they could prove they qualified for coverage based on disability, were pregnant, or over 65. But under the ACA, homeless adults in the Medicaid expansion states now had coverage available. However, the current administration now gives states the opportunity to take away Medicaid coverage. This usually only happens whenever they do not work a specific number of hours. This is only the case if a Medicaid enrollees aren't disabled, pregnant, or over the age of 65. The specified number of hours, though, could include job training or even volunteer hours with the current administration. So in conclusion, the ACA has been a game changer for the homeless adults and their doctors. A study in California has shown that clinics that provide health care for the homeless in Los Angeles reported that 80% of their homeless patients are covered by the ACA expansion or Medi-Cal. If homeless individuals are able to benefit from the expanded coverage and have their medical needs addressed and treated, they may be able to get back on their own 2 feet. When homeless individuals are rehabbed and able to come to a contributing member of society, it's a win-win for all. Even under the new administration, if one is to volunteer or have job training that's documented, they will still qualify for the Medicaid expansion regulations under the new administration.